Hello my friend and supporter, welcome to medical science class. As a student of medical science, I wanted to take play by every concept of science. What kind of things say do, that is God, that is knowledge, that is Jesus, and that is good work, that is honor. As a Muslim, Allah is the one and only creator, it's about all our creation, last and best Muslim. Ya Ali Tam Nama, Ya Allah Shafi, Allah Mafi, Allah Kafi. Ana Abdul Mamushir Shafi, Ana Abdul Mamushir Mafi, Ana Abdul Mamushir Kafi. Now my friend, subject medical science class, we learn medical science. In case of last class, we discovered about heart disease. In case of medical science is vast. If I do any mistake, you see the main book, medical main book. In case of medicine, Science Davidson. In case of billion surgery billion, and in case of gynaecs, main book. Medical science is also vast. So that is the reason. If I do mistake, that is usual. You see the main and correct that. Yes? Okay. Now in medical science, heart disease, elaborated heart disease, and in case of we discovered about heart disease. And now in case of lung disease, what happens? Lung area, you occupy the lung area. And in case of lung disease, what is the symptom of lung disease? Coughing, common symptom, coughing, breathlessness, and coughing, breathlessness, that is the common symptom of lung disease. In case of lung disease, what happens? There is a oropharynx, laryngopharynx, oropharynx, nasopharynx, laryngopharynx. Larynx, trachea, trachea. Pharynx, esophagus. In case of trachea, there is a, in case of oropharynx, in case of starting of the esophagus, there is a epiglottis. When we take food, that stop that trachea, tracheal tube. Then food passes to the esophagus, to stomach and GI tract. But if any food enter into the trachea, then fall in danger. In that situation, what you do, already said, you try the food can out and go as much as possible, state the trachea, food come out. If not come out, there is a tracheal ring, there is a insertion. Not need insertion, you give the syringe and air enter into the trachea. Now, in case of Lyme disease, cough, sneezing. In case of dry cough, somebody say 6 months dry, 3 months, 6 months dry cough. Cough is not cured. That is, in case of that is allergen particle do that dry cough. That is the reason antihistamine. Treatment of choice, dry cough, antihistamine. Now productive cough. In case of productive cough, if sputum test, you found bacteria and antibiotic. You found viral, antibiotic. You found fungus, antifungus. You found protozoa or protozoa, antiprotozoa. Protozoa unusual. You found the fungal ghost. Then in case of fungal disease, aspergillosis, you found the fungal ghost in X-ray. Then you give the antifungal drug. How you understand that your lung is work good? Your respiratory rate, inspiration, expiration. Inspiration, expiration rate, normal 16 breath per minute. Normal 16 breath per minute. Normally what happen? But if inspiration is prolonged, reduce the expiration, what happen? There is a chance of lung disease. What is this condition? You know that asthmatic patient or any lung infection or tracheal obstruction. In case of asthmatic patient, if you fit the stethoscope to trachea, you found the wheeze, fluid sound, then you confirm that that is tracheal ring obstruction, either allergen particle or nor asthmatic particle. That is called asthma, narrowness of the trachea. In case of asthma, treatment of choice, asthmatic patient, salbutamol, aminophylline, theophylline, তারপরে হলো then if not work, salbutamol oral route and gaseous to nebulization. If not work, then steroid nebulization. Okay, fine. That's the treatment of choice. Lung and lung, we have two lung, right lung, left lung. Left lung have two lobe, upper lobe, lower lobe. In case of right lung, three lobe, upper lobe, middle lobe, lower lobe. And lung covering is called pleura. If pleural infection occur, what happen? If in pleural infection occur, what happen? Pleural edema or fluid remain in normally few fluid remain in pleura, but if it above the normal range, that is the pleural edema. What is the treatment of choice? Correct the pass and see that specific. And what is that? Is bacteria to antibiotic. If bacteria, antibacteria. If viral, antiviral. If protozoal, antiprotozoal. If antihistamine. If fungal, antifungal. Sometime in heart disease, also called pleural edema. That is the reason if heart disease present or not, see that. In case of diabetic patient, sometime if glucose level reduce, that is heart rate reduce. If heart rate increase fast, then reduce. Then